This is Rural Health Leadership Radio.
Hi, everybody. I am your host, Dr. Bill Oxier, and I welcome you to this special edition of Rural Health Leadership Radio. I'm very honored and excited to have a conversation with our guest today. Today's guest is George Puckett, the president and CEO of Verity Solutions. Welcome to Rural Health Leadership Radio, George.
Hey, thanks, Bill, and enjoy the opportunity to talk to your listeners.
Absolutely. So tell us about yourself. Who is George Puckett? What's your story?
Oh, who is George? Well, so let's see. I'm a healthcare computer nut, and I've always been in healthcare, mostly in inventory management and pharmacy inventory management. So across my career, Bill, I've done all sorts of projects for a lot of hospitals and pharmacies, retail pharmacies, long-term care pharmacies, any kind of pharmacy you can think of, I've been involved in my life.
Okay, that sounds interesting. So,
and always been an entrepreneur along the way. So always building companies. And
well, as a kid in Louisville, did you use a Louisville Slugger?
Yes, I did use a Louisville Slugger. You bet.
Of course. Well, that's a business that launched in Louisville that has certainly been a big hit, if I may use that pun.
Oh, you bet. Actually, it was always great if we had visitors come in for a company meeting in Louisville. We could always take them on a tour of the Louisville Slugger Museum, and it would always be a big memory to
absolutely
to take away from them. And actually, somebody else that you might know from Louisville that as part of my background there was the first human artificial heart. Developed by Humana in combination with Dr. Jarvik, and I wrote the software for the Jarvik 7 artificial heart.
Oh, wow. Very cool. Very cool.
As a 22-year-old, how about that?
Hey, that's great. That's really awesome, man. What a history to have. So how in the heck did you end up with a career in healthcare?
Well, I always laugh with my kids because they always say, "Oh, sure, Dad, your life is this great straight line up and to the right, and you've planned your whole life in increasing seniority as you've gone along." I just laugh and say, "Well, no, you kind of stumble from one serendipitous opportunity to the next and hope that you make more right moves than not right moves." But because Louisville was such a healthcare-oriented city, and I had attended school at University of Louisville Speed Scientific. And they were very connected to the various hospitals in Louisville. And I started doing a bunch of statistical analysis work.
Okay.
So in fact, before I did the artificial heart program, I did the largest heart study ever done. I did all the statistics for that. And that's how I got connected to it. And of course, healthcare and computers are a good combination, right? You need them. And
yes.
It was just a good business opportunity for me to continue rolling down that road.
Very interesting.
So it was a good break, and I just always enjoyed it.
Yeah, it is very interesting. I know that they've always had great cardiac programs there. My dad, when he had to have bypass surgery in Jewish Hospital in Louisville, was one of the first big places that did that. So
there was huge competition between Jewish and Humana.
Yeah.
So Humana had the first external artificial heart, that Jarvik 7, and Jewish made history with the first implant.
Right.
They had a heart assist device that they implanted. So it was, as you said, a very energetic healthcare IT sort of development space.
Absolutely. Absolutely. So that explains how you got into healthcare. What about rural health? How did you come to focus on rural healthcare?
Well, it's interesting that you say that. So Louisville is sort of in a funny geography that around the city of Louisville for at least 100 miles, maybe 200 miles in some directions, there isn't any other city. It's all farmland. So what happens is a lot of people come to Louisville for jobs,
right,
and a lot of people come there for healthcare. It's one of the reasons why both Louisville and Lexington are such big healthcare centers, because there just isn't anything for hundreds of miles around those facilities. And so then it doesn't take much to start finding your way out into rural health to really learn about it. And I got connected early on in the 90s with the 340B program. In fact, I was one of the guys that came up with the concept of virtual inventory for 340B. So I was right there with the very first software for 340B at the beginning of the whole program.
Interesting.
And the guys that need it the most are the rural healthcare facilities, FQHC, federally qualified healthcare centers, community health, rural health, they are even more in need of 340B than the bigger downtown sort of disproportionate share hospitals. So it just was sort of a natural progression again that I could do the most good in rural health.
Yeah, part of the master plan, huh?
There you go again, Bill. Just like I tell my kids, it worked out that way. But yes, it looks in reverse like it was part of the master plan.
That's cool. So, George, as you know, the name of this program is Rural Health Leadership Radio, and I emphasize the word leadership. What's your definition of leadership?
Well, it's always a great question. What do you think leadership is? So for me, the definition of leadership is I've got to have the vision and the passion. And so somebody's got to come up with the direction that we're going to go. And of course, the alternative is a mob, and we all just run in every different direction.
Yes.
Sort of in a disorganized way. But somebody's got to come up with that vision and then really drive it through. And you can't make people do it. You've got to get people to buy into this vision that you've come up with, and you've got to sell it with passion, and you've got to help solve problems and take them down that road. So I always wanted to be the guy that had the idea and sort of developed the passion and direction. And then you surrounded yourself with a lot of good people who could help you get that done, but you can't make them do anything either. So you got to get them to do it because they want it. So,
yeah.
I appreciate. So again, we want to be the guys out front with the ideas, leading people, not pulling people.
Got it. And I appreciate how you married those two words, mission or passion and vision with each other. So thank you for sharing your definition. You're the president and CEO of Verity Solutions. Can you give us an overview of Verity Solutions and the community that you serve?
Sure can, Bill. So Verity is a 340B software vendor.
Okay.
Well, software and services, I'd say. It's software is how we think about it, but in reality, software is just the tool to make all the services come together.
Got it.
So one of the complexities of 340B is how to manage the program. And of course, for most of our rural facilities and larger hospitals too, in general, everybody in the healthcare space is busy doing healthcare. And they're not experts at 340B, which is complicated and has all sorts of arcane regulations. And so Verity's really taken the approach, Bill, of being a very hands-on sort of white glove vendor for our customers. We really do all the work that it takes to run the program, to keep these smaller, maybe less sophisticated rural health facilities compliant.
Okay.
In rural health, it's kind of like you think about your taxes, right? You hope that an IRS auditor doesn't come in, right? But in 340B, an auditor is always going to show up. It's just a matter of when. You're always going to get audited someday. And so that means a federal auditor is going to show up and look through every single thing that we've done, maybe years after the fact. And it's got to be perfect. And so that's hard for somebody who doesn't really do this all day long. So I wanted to build a company that was going to be the experts in this process and really just take all the heavy lifting from our partners.
Makes sense. Thank you for explaining that. Now, as we all know, the COVID-19 pandemic has turned everybody's world upside down. And I'm guessing the same goes for you. So what impact has it had on your company?
Well, happily, it hasn't had any negative impact on Verity. We've still been able to successfully accomplish our mission. Now, albeit we're all in sort of the weird work from home, nothing is like it was before world. Everybody's got kids and dogs barking in the background,
right.
But we're still able to get our work done. Now, unfortunately for our hospitals, right, they've been overwhelmed with treating and coping with COVID, often at huge cost to their overall revenue. So I talked to many of my hospital customers and community centers and FQHCs, and they tell me that they've just been devastated financially by the COVID crisis because they're not doing any elective surgeries, for example.
Right.
Nobody comes to the clinic unless you have COVID.
Right.
So as a result, financially, you're really challenged by that. And so what we've been really trying to focus on happily, because we haven't been too beat up by the COVID crisis, is really finding new ways for our 340B customers to save more money with Verity.
Okay. All right. So you've been able to help them while it's impacted you. You've at the same time, you've been able to help your clients weather the storm, so to speak.
Yes. Yeah. So we've done what we can. Certainly there were things like, extending payment terms or reducing prices. We've done all of that we can, but oftentimes the part that we can make a difference is such a tiny part in their bigger problem.
Yeah.
Like, well, what you really want me to do is to help you make some more money. That would solve your problem more than me giving you $1,000 off of my service, which I'm
Yes.
happy to do, but let me figure out how to make you some more money. So that's what we've really focused our attention on.
Got it. Got it. Very good. Nice value added there. So why is, you may have already answered this question, but why is rural health so important to Verity Solutions?
Well, it's a good question. Of course, we think that all of the various healthcare players in the 340B space are important customers. But in terms of the numbers, and the need is really in rural health. So there's more rural health facilities than there are going to be big urban hospitals. There'll be
Okay.
hundreds more. So there's a bigger need for it. And those guys need more help. I always remember, for example, going to the very first rural health award ceremony, and some of these critical access hospital leaders stood up on the stage to get their award. And he would bring 3 people up on stage with him, and they would each have 5 jobs.
Right.
In the
Yes.
introduction, they would list them off, and I'm like, wow, these 3 or 4 people that are standing here on the stage are essentially the entire leadership of this small FQHC or hospital. And no wonder they never seem to have any time to talk to me, and no wonder they don't have anybody that they can bring to the meeting to talk about their interface specs. No wonder. And so it was a very instrumental for me to watch and sort of learn that process. And so we really, in fact, I came back from that first experience and set up an entire division of Verity just to focus on the rural health marketplace, because I saw that their needs were way different than what our bigger urban hospitals needed.
Yeah.
So it just seems to me like that's the place that needs us more.
Yeah, absolutely. I get that. So if a rural health leader, whether they're at a FQHC or a critical access hospital, whatever, if they think, hey, you know what, I do need some help here. I need some help administrating my 340B program. And they want to look around at what their options are. What are the top 3 things that they need to think about or consider when they do that?
Top 3 things, huh? Well, let's see. We gave some thought to what that might be. So one of the first things that is unfortunate, I think, for a lot of the smaller FQHCs and community health and rural health customers is that they haven't had very much experience with the various vendors in the 340B space.
Right.
So a lot of times what it seems like is if they've met one 340B vendor, that they assume that's it. And so they got to understand that there's not thousands of us. There's probably 25 of us out there that play in the space. Verity's been an award-winning. We win the best in class awards, kind of like the JD Powers Award. We win the best 340B vendor award every year.
Wow.
So every year since Verity's existed, we've won the best 340B vendor. So, but they've got to do some research. And so one of the first things they want to do is make sure that they find a vendor that can really support all of the different pharmacy partners that they have to connect to. Because the way 340B works is we have to connect the healthcare facility with the pharmacy. And together that makes that's how they make money in the 340B program. But if you can only work with independent pharmacies, or you can only work with one big pharmacy chain, then they'll unfortunately have to get 2 or 3 or 5 different vendors to come help them solve that problem. So they should really find somebody that can do it all. That's one. The second thing is they're going to have to be sure, Bill, that they find a vendor that can give them this kind of support. Right? So you've heard me talk just briefly about some of the whole separate division, the focus on how to really serve these customers. If you find a vendor that provides no backup support, do they have any legal and compliance support, right? Because if your vendor can't help you with that, you've got to hire a very expensive 340B attorney.
Got it.
And you can imagine they're not one of those on every corner, so they're expensive. But Verity provides that, no charge to our customers.
Wow. Okay.
Right? I have 340B attorneys on staff, and we're happy to let you talk to those. And then finally, you got to have somebody whose pricing is very transparent. So I get frustrated. Some of the competitors have this very unfriendly pricing, And I hear some of our customers talk about how they really got ripped off because they paid way more than they thought they were going to pay because of all this non-transparent pricing. So somebody that can do all of it, somebody who's got really transparent pricing, and somebody who's got really good support.
Excellent.
To help a small facility.
3 nuggets every rural health
Yeah.
leader needs on something like this. So that's cool.
Exactly. That's true.
So you've worked with a lot of rural health leaders, as you've shared, long-term care facilities, hospitals, clinics, et cetera. What are some of the best practices that you've seen some of the top rural health leaders that you've worked with embrace around the type of solutions that Verity provides, Verity Solutions provides?
Oh, great question too, Bill. So, one of the first things they've got to do is they've really got to sit down and work with their vendor, Verity, whoever it is, to understand how their program works and how to improve it.
Okay.
So I find a lot of smaller customers, they haven't changed their program in 10 years, but the 340B program has changed a lot in 10 years. The players have changed, the pharmacies have changed, the different ways to make money in the 340B space have changed. And if you haven't examined your program lately, you're probably paying way too much and you're not getting as much out of it as you could. So they've really got to sit down and study their contracts and their dispensing fees carefully to manage their network. That's one.
Okay.
The second thing that they've got to do is they've, again, really got to study their compliance. So many times they didn't, when you set things up, right, we're all naive. My mother used to always tell me, Bill, that everything is easy once you know how.
Right.
It's just the learning how part that's hard, right?
Yes, exactly.
And so you've got to count on the fact that Verity's done this thousands of times and it's all we do, right? I started 340B right in the beginning. I was the first vendor. I was the first 340B vendor. So we have a pretty good head start on what it takes to be compliant. And they've got to really study that, because if they have to pay back the money, imagine that federal auditor saying you got to pay back 2 years of your 340B savings. That might be several $1 million. What do you think that's going to do to that rural health facility? That might be a killer.
Yes.
Happens. You can't afford that to happen.
Right.
So, and then they've got to expand their network. So a lot of times they've just been satisfied with, well, we have 5 pharmacies we connect to and they're satisfied with that. It works. But it's like, well, yeah, but what about connecting to Walmarts or Walgreens or Kroger's or CVS's and Rite Aids? And they're like, oh, we never have got around to do that. And you're like, well, you're missing huge opportunities.
Okay.
To do those. So best practices are, again, to, really review the program that you have.
Yes.
Really be careful about the compliance, and then study the fees that you're both paying and making in the process, so that you don't leave opportunity on the table.
Gotcha. Makes sense. Is there an example that you could give us, maybe a client that you've worked with that, has really had some great results by working with Verity Solutions that you can share with us?
I would be happy to, Bill. So of course, one of the things that I always tell my team is I think every Verity customer ought to be a reference.
Yes.
And so if I got a customer that's not willing to be a reference, we're doing something wrong. And so we sort of operate under that model that everybody we ought to treat like they're our reference customer. So we have a lot of really great stories about how we've helped them.
Okay.
But, one that comes to mind, we've got a hospital, it's called East Alabama Medical Center. They're in Opelika, Alabama, which is kind of funny. I don't get to say Opelika very often.
Yeah, you did a good job there. I'm glad I didn't have to say that.
And when we think about what we've been able to do to come in and really build out their program, and so we had an opportunity to go visit the hospital as part of a cancer center that they were opening. And so we got to meet people in the community and to hear the stories from the community about how 340B has helped them.
Wow.
Because remember, the purpose of 340B is to provide money to these hospitals, care centers, clinics, rural health facilities, so that they can provide care potentially for free to indigent patients. So a lot of times this 340B bill pays half or more of the total indigent care that the 340B facility provides. And so there are a lot of great stories from the community about how we've grown their business and really kept them. This EAMC would tell you that we've kept their doors open. They wouldn't be in business today if it hadn't been for the work that we did to grow their program and generate that funding.
That's great. And that's
it's fun to hear that.
Absolutely. That's got to make your day when you hear something like that.
Yeah, and in fact, Bill, something else that's a little off topic, but I started a 503c nonprofit called Community Voices for
Oh,
340B, and I'm the president of that. But it's actually made up of all the 340B vendors. So all of our competitors have come together with me to try to educate the community on 340B, because I should be able to go to any church or community center
hmm,
and say you are getting the benefit of this 340B program,
right.
and they don't even know it. They
Yeah.
have no idea what it is, and so it's no wonder that there's all this confusion and haze over 340B. And so that's another organization that we've really driven a lot of sort of community involvement around 340B to understand how they get benefit out of
Well, that's great because you've combined vision and passion there, going back to your definition of leadership on delivering this 340B program to
it. But we
people in the
really try
community.
hard to do it.
Yeah, that's great. Thanks for sharing that with us. George, you've got a lot of experience in healthcare and rural health in particular, so you have a good overview of what's going on in rural healthcare. What scares you the most about the future of rural health?
Well, it's a tough time,
Yeah.
right? I mean, all rural health was already struggling for funding before.
Yes.
And now you look at 2020 and both the COVID crisis and the economic crisis that's occurring, and it's really scary to think about how if I were a CEO of a small rural health facility, how I'd be planning to keep the doors open, right? And again,
Right.
I talk to my customers, and they're like, in fact, one of them told me, George, our facility is funded by a bond in our county.
Mm-hmm.
And if I fall below a certain threshold in the bank, right, I think he told me they had to keep it at more than 90 days worth of expenses in the bank.
Yes.
And he says, right now I'm at 121 days. If I fall below 90, they're going to call my bonds.
Oh,
And our
yes.
facility and all the jobs are gone.
Right.
And so that, to me, that's really scary, because if we allow our rural health community to unwind, then we're going to force everybody to travel to a big urban center to get any kind of healthcare. It's going to really change. It's really going to change the way that Americans experience healthcare in a very unpleasant way. So it
Yes.
scares me that this particular time is even harder than usual for the rural health community, and it's so important that vendors like Verity really help our customers find out how to make more money, be more compliant, figure out how all these things work. There's so many things they leave on the table as opportunities that I often just shake my head about. And of course, it's just, they don't know.
Mm-hmm.
And they just need somebody to help them with that. And so that's what we've tried to do in many ways.
Yes, that makes sense. So thank you for
Scary
sharing that. So let me flip that question around to get away from the scary stuff to the exciting stuff. What excites you the most about the future of rural health?
Well, of course, like it's the scariest time. Of course, that makes for the best opportunities,
Right.
right? So another thing my mother always told me was, if it was easy, son, anybody could do it.
Your mom was a smart woman. She's got a lot of good
Really
expressions.
smart one. You bet. I love her expressions. I always tell her she's famous because she gets all these expressions. So if we're easy, son, anybody could do it. And so there's lots of problems here, which means there's great opportunity for us to fix some of these problems and really help these communities maybe change even the face of how healthcare is delivered in their community. I think that is certainly a big opportunity. Something else that's happening, ironically, in this combination of we'll destroy our rural health, but where's everybody moving? I read article after article today that people are moving out of cities to the
Right.
country.
Right.
So what a disaster if we unravel our rural health and everybody moves to the country and we have no rural health. Boy, what a mismatched opportunity. So again, Bill, I'm excited about the fact that today it seems like more than ever there's opportunity there to really make a difference in the way that America serves rural health.
Yes, that is exciting. I appreciate your perspective on that. George, in the short time we've been talking here, we've covered a lot of ground. If our listeners only take one thing away from the conversation today, what should that be?
One thing, huh? Well, I think 340B matters to rural health. I think that's the key thing. And it's so important that they understand how 340B fits into it. If they're not taking advantage of it, they've missed a huge opportunity. It's true. People will sometimes say to me, Bill, yeah, but there's regulatory risk and I'm scared of 340B. And I said, well, would you deduct the mortgage the interest you pay on your mortgage on your income tax. Yeah, it's a little risky. You might get audited by doing that. Well, of course I'd take that. It'd be foolish of me not to. Okay.
Right.
340B is the same way. Yes, it might be a little scary, but you have to do it. And so maybe that just means you have to get somebody that you can really trust to do that. So the key is there's a big opportunity in 340B, and if I guarantee that they could do more. I've never met yet anybody in the rural health space that couldn't do more than they were doing, and they just really need to dig into it and learn more about the savings that they can take advantage of.
George Puckett, President and CEO of Verity Solutions, thank you so much for joining us today and sharing your knowledge and expertise.
Well, thank you, Bill, and thanks to all your listeners.
If you would like to connect with George, or if you would like to connect with Verity Solutions, you can look at the notes below this video and find the contact information on how to reach them. Of course, you can always check out their website. It's pretty simple. It's Verity340B.com. And if all else fails, reach out to me and I'll be glad to put you in touch with George and his team. If you'd like to learn more about Rural Health Leadership Radio, hey, do you have a smartphone? Well, guess what? There's a podcast app on there, and all you have to do is search for Rural Health Leadership Radio, and when it pops up, hit the subscribe button. And of course, you can also visit our website too at www.rhlradio.com. If you enjoyed this special episode of Rural Health Leadership Radio, or you know somebody who might benefit from what George was talking about or the services that Verity Solutions provide, please share this, because we are all here to serve you. Until next time, let's keep working to improve rural health, one conversation at a time.